Good afternoon, everyone, and welcome. My name is Caroline Moreau. I am a professor in the Department of Population, Family, and Reproductive Health. I've been at Hopkins about 12 years, and my area of expertise is sexual and reproductive health. I have another gig as I'm working as a senior researcher at the National Institute of Research in France. And so today I am very pleased to actually wear my double hat and present some of the first findings of the 2023 Contexte des Sexualités en France, which is the National Survey on Sexuality and Sexual Health. The survey was conducted in 2023. It kept me busy for about 5 years. And today, the title of the presentation is Sexuality and Sexual Health in France from Past to Present, a 30-year overview. So that's the official title. I could have chosen something a little more catchy, as you can see here on the screen, which was a highlight of a press conference that got a lot of attraction. And the title suggests sexuality of French people, so happy. Question mark. So let's find out. And I'm going to try to not mess up that. Great, this works. So this is a study that I co-lead with two French colleagues, Nathalie Bajos, who is a sociologist, and Armelle Andro, who is a demographer, and it's actually the fourth edition of national surveys on this topic in France, which is pretty unique, as it provides a unique perspective with national data tracing back to 1970s. In fact, we have available and comparable data since 1992, which means pretty much a 30-year retrospect, starting in the era of the HIV pandemics with research that was very much directed towards informing safer sex practices, to a more contemporary view and recent impact of the Me Too movement, which has reshaped conversations around sexual violence and consent. So the last survey on this topic was conducted in 2006, so that's almost 2 decades ago. And in the meantime, French society has experienced many changes, social, legal, and technical, and from a technological point of view. And that has many influences on sexuality and sexual health in terms of representation and practices. So we decided to revisit the question of sexuality across its different dimensions, as we see it as a dynamic human experience that is informed and shaped by institutions, by actors and norms, and therefore shifts with societal shifts. We consider the 3 dimensions around representations or norms, practices / behaviors, and relationships. And we also embrace WHO's definition of sexual health as more than just the prevention of disease, but more a holistic aspect of physical, mental, and social well-being in relation to a positive and respectful approach to sexuality and relationships that are free from coercion, safe, and pleasurable. The research addresses 3 key questions. The first is around the diversification of sexual representations in practices within an evolving context around gender relations, changing sexual or lifestyles in general, and also kind of advancement in the development of the digital space. The second one is around the impact of living conditions on sexual life, considering family dynamics, economic status, working conditions, migration, residential situation, which all have an impact on the ways and abilities to negotiate sexual relations, safe and consensual. And finally, the third dimension is around the connection between sexuality and sexual health, and more broadly, different aspects of health, including mental health and chronic illness at different stages of the life course, and also considering new ways of accessing healthcare systems in connection to sexual health. So I'm not going to address all of these questions, or we would still be here tomorrow, but I'm going to really focus on trends in sexuality and sexual health indicators, both by gender and age. Stay tuned. We're still doing, or we're just launching the, is that my phone? No, that's not me. Sorry. We're just starting the investigation around social patterns that will be the subject of a book that will be published in 2026. So if you like this talk, you can invite me again in a years from now. So the data I'm going to present today draws on 3 cross-sectional surveys. They're probability surveys that are conducted in 1992, 2006, and 2023. They use the same sampling design, which is a random digit dialing method that consists in selecting random phone numbers and then one participant by phone number. In earlier editions, most of those phones were landlines, which meant we had to do a roster of household and select one person by household. This has made it easier across time with rising coverage of cell phones where there's generally one user per phone. The sample size ranges from 12,000 to about 19,000 of people who are aged 18 to 69. They all responded to a phone survey which lasted between 35 minutes and 49 minutes. And actually in the latest edition, 35 minutes of phone were complemented by an online survey. To address both unequal selection probabilities as well as non-response biases, all of those surveys are weighted to adjust for non-response and match the distribution of the census. And I'll come back on some of those details when I talk about the characteristics of the 2023 survey. So the 2023 survey actually has more features than the preceding ones. Number one, it expands the age range from 15 to 89 instead of just 18 to 69. Number two, it extends the geography with previous editions that are concentrated in continental France. And this edition also including overseas territories, 4 overseas territories that are located in the Caribbean and La Réunion. So today I'm just going to talk about continental France for purposes of comparison and also because analysis in those territories is not complete. So overall, the survey includes about 31,000 people. 20,000 are located in continental France and 10,000 in the overseas territories. They responded to a phone survey first, and then people who were aged 18 to 89 were invited to respond to the online survey. And lastly, we also have a biomarker addition by proposing a STI screening kit to people who were aged 18 to 59 and reported any sexual activity in the phone survey. So ultimately, 31,000 responded to the phone survey, about 17,000 to the online survey, which corresponds to 61% of eligible people, and about 5,700 responded to the STI component, which is about 50% of eligible people. I haven't talked about overall response rate. You see, I've kept it very quiet. But before I do that, obviously the study follows pretty stringent ethical rules People give consent to participate in every module, meaning they can consent to the phone survey, but drop off of other modules. This study was approved by 3 entities. It took 18 months. It almost drove me insane, actually. But the data collection went on from over a year. Between November 2022 and December 2023, it took about 65,000 hours of interviews that were all supervised by a polling company, but also with additional supervision from the research team. We were listening almost every other day. So let's go back to the response rate. It's 34%. So I can see, maybe not in this room, but maybe on internet, some of those demographers in our department raising their eyebrows. 34% is maybe not much, but actually in this type of survey, it's more than 3 times the average. That for random digit dialing, it's about 10%. And for online panel surveys, it's even below that. Well, people are not even selected in a probability manner. So basically, while the response rate is not that high, it's greater than in most surveys that address the question of sexuality and sexual health. The other component that I can share with you is that most people who refuse to answer actually hang up before even knowing about the topic. They're solicited for commercial reasons and they just don't want to respond to anyone they don't know on the phone. For people who were eligible for the study and were informed about the subject of the study, the refusal rate is between 15 and 20%, depending on the territory. So what do we ask? Lots of stuff. It addresses a range of topics, and it both maintains comparability over time, but it also introduces new topics to address contemporary issues in this particular edition. So the survey starts with an extended sociodemographic module that then is followed by more sensitive questions, starting with attitudes and education around sex, followed by concerns or topics related to sexual partners, attraction and identity, moving into questions related to different sexual practices, including digital sexuality. And then we also explore numerous sexual health topics, such as sexual violence, sexual dysfunction, STI prevention, contraception, as well as access to healthcare services for sexual health services. So this first table presents the distribution of survey respondents by age, sex, diploma, and it compares the initial sample that's unweighted in the first column to census data in the second column. And in the third column, you see kind of the result of the weighting strategy. So if you look at the first column, there are a few places that are highlighted showing distortion of the sample compared to the distribution of the census, and especially older people. And that was actually by design because we included just 1 out of 2 people who were 65 and older, unfortunately for budget constraints. The other underrepresented population are people with less than a high school diploma or no diploma. That's pretty typical in this kind of survey selection. But as you can see, once we apply post-stratification weights, most of these discrepancies and distortions are mitigated. This post-stratification strategy is based on age, sex, education, household composition, and region of residence. So now let me turn to the results, and there'll be two parts. In the first, I will discuss changes in the social landscape of sexualities, and I will mostly focus on a population that's 18 to 69, and that's because of comparability across studies. Then I'll turn to the topic of sexual health, and that will include various populations depending on the topic that is considered. So let's begin with sexual initiation. And you see here in the graph, this is a representation of median age at first sex over time, starting in the 1960s. In green, across this presentation, women are in green and men are in orange, just so you know. And so what this graph shows is a consistent decline in the median age at first sex from 1960 to around the early 2000s. And then you kind of see a stall or even a reversal of this trend in the early 2000s, when actually an increase in delay or age at first sex, especially for girls in the most recent period. So in 2023, the median age at first sex is established at 18.2 for girls and 17.7 for men. So this trend has attracted a lot of media attention in France, but it's not unique to France. We see it in many high-income settings, including the US. And so there are potential different reasons that have been proposed to understand this reversal of trend. So the first one is that sexual initiation may not always mean intercourse, and young people may engage in earlier activities that don't necessarily include penetration. The second is that there's a rising concern around mental health issues with young people starting in the mid-2000s, around 2006, I believe. And that has repercussions on the ways they engage in relationships and potentially their sexual initiation. The third is that this trend is not unique to young people. And as you will see in the next slide, declines in partnered sexual activity affect all age groups. So here, this is kind of a busy slide. On the left, I think for you, basically the green, are women, and on the right are men. And we're looking here at the proportion of people who report sexual activity in the last 12 months with 3 time points: 1992, 2006, and 2023. And I'll start by describing kind of the middle of this graph. I don't know if you see the pointer in those full lines. So these are women and these are men. And in the lighter color, we're talking about younger people who are less than 30. And in the darker color here, we're talking about people who are the full age group of 18 to 69. So what is visible on this graph is a decline in the proportion of people who report any sexual activity with a partner in the last 12 months. This is true for women. This is true for men. And you can even see, you can see even a greater decline. Can I get it right? There we go. Greater decline for younger boys. Next, we looked at this trend for people who had partners and people who didn't have partners. So if we go to the upper part of the graph, these are people who have partners. And you can see kind of a trend towards less sexual activity, but actually the decline is not significant. And it's true for people who are younger or older, and the same for men. But now if we go to the bottom of this graph, these in the pointed dots, you see people who are single at the time of the survey, and you see substantial declines in sexual activity over the last 12 months, both for women and for men, if I get to the men. And this is true for younger and older populations. Next, among people who have sexual activity, we also find a decline in the frequency of sexual activity with a partner in the last 4 weeks. So again, these graphs, women in green, men in orange, and these are different age groups. Darker colors are the older generations, lighter colors are the younger generations. And just looking at the pattern of the graph, you see declines in the average number of sexual acts in the last 4 weeks for all age groups. And that's true for women and that's true for men. On average, in 2023, for people who had sexual activity in the last 12 months, women reported 6 acts of intercourse in the last 4 weeks, and men 6.7. So this comes to kind of one of the first conclusions in the news when we presented those results. French people are having less sex. Should we be concerned? So we asked, we asked people if they felt that the absence of sexual activity was a problem or was suitable to their circumstances. And here on the left, you see the graph showing how people react to this absence of sexualities, indicating that that suits their situation. In green are women and in orange are men. I see laughs in the room. It suits much more women than it does men, but on average, 76% of women find this situation suitable versus about 55% of men. They have especially mixed feelings when they're in their 40s and 50s. When we compare people's motivation for engaging in sexual activity, and we compare responses in 2006 and 2023, that's moving to the graph on the right. Lighter colors are for 2006, and stronger colors are for 2023. Number one, these are the proportions of people who engage in sexual activity to please a partner without really having any desire for engaging in sex. So you see this proportion, regardless of age, regardless of year, being much higher for women than they are for men. But what's really interesting here is that if you look and focus on women, you see a drop in this proportion of people who engage in sexual activity only to please their partner between 2006 and 2023 for women, while it's pretty stable for men. So together, these results suggest that part of the explanation in the decline might be a choice, with women having more opportunity to voice their own sexual desires. So we talked about partnered sexual activity maybe being less frequent, but it continues well into senior years. That was also something that excited the press. So when we looked at and calculated years of sexual active life expectancy, which is the average additional years of sexual activity at any given year, the first findings is that for men who are in their early 20s, they can expect about 53 additional years of sexual activity versus 49 years for women, even though women are going to live on average 4.6 years more. That gender gap, however, is largely due to the fact that women lose their partners earlier than men. The interesting fact that you can see here on the graph is focusing not only on the green curve, which is overall sexual active life expectancy, but going down to the purple curve. And this is adjusting for sexual satisfaction. So in some ways, it's a quality adjusted sexual life expectancy. And here you can see kind of an equalizer between women and men. as the adjusted sexual life expectancy that accounts for satisfaction is about equal. It's 39 for a man in his early 39 years for a man in his early 20s versus 38 for women. And that's because men lose many more years of sexual activity, quality sexual activity than women, because they're generally less satisfied with their sexual life. Which brings me to the next slide around sexual satisfaction. And because in France we're perfectionists, we only look at people who are very satisfied with their sexual lives. So again, women are in green, men are in orange, and we have being very satisfied by age group, and 3 bars by age group correspond to 1992, 2006, and 2023. So overall, the results suggest that women are more satisfied than men, and that's true for each age group. Second, that there's a decline in sexual satisfaction, mostly between 1992 and 2006, but there's a rebound in 2023. And this rebound is noted in each age group except for men who are in their 60s. So in some ways, even though people are having less sex, they're not less satisfied. And especially men, where there's a significant rise in sexual satisfaction, while for women, it's not statistically significant. So going back to the argument of choice, it may be that we're adopting quality over quantity. Which brings me to the next key trend in sexual practices, which has to do with diversity. Diversity in partners, diversity in practices, and even diversity in the places where sexual exchanges happen. So here, starting with partnerships, we find that lifetime number of sexual partners has increased over time, and this is for men and women and across each age group. On average, the number of lifetime sexual partners has increased from 3 in 1992 to 7.9 for women who are 18 to 69, and from 11 to 16.4 for men of the same age group. You see the rise being particularly striking for young people below the age of 30, where it goes from 4 to 7 between 2006 and 2023 for women, and 7.8 to 11 for young boys. So a common question is, why the gender gap? Why are men reporting twice as many partners as women? So there are many factors probably, but one central factor is that the definition of a sexual partner is not the same for women and men. And that's really socially constructed. And a French sociologist talks about this, saying that women only count partners that count, versus men count all partners, as sexuality is very gendered, and emphasis on emotional bounds for women and emphasis on physical performance for men. And that has resonance in the ways that people report their sexual partners. The rise in sexual partners is also striking when we look at the number of partners in the last year, and that's in the graphs on the right. Again, women and men of different age groups, darker for older people, lighter for younger people. And I'll just kind of point you to the upper part of those graphs. For people who are under the age of 30, the number of people who report several partners in the last year rises from 9 to 24% between 1992 and 2023 for girls, and from about 23% to 32% for young boys. diversity is not only the number of partners, but it's the type of partners. And here we're looking at same-sex partnerships and lifetime reporting of same-sex partnerships. 10% of women 18 to 69 report having ever had a same-sex partner versus 8% of men. But what really is striking is when you look at it by age group, and specifically for women who are less than 40. The number rises from 2% to 5% between 1992 and 2006. Those are the two lighter bars, and up to 17% in 2023 for women who are less than 30. Again, for those who are 30 to 39, we're going from 4% to 15% who have ever had a same-sex partner. Moving to men who are less than 30, you also see a rise from 3 to 11%, but it's less striking than for younger women. Sexual orientation is not only a matter of the sex of the partner, it encompasses different dimensions, including attraction and identity. And here, just concentrating on numbers for 2023, we find about 15% of women, 8% of men report, and they're age 18 to 89. In 2023, they report having been attracted to a same-sex partner. And you see again those numbers rising sharply for the younger people, going up to 37% for young women and 18% for young men. We've already talked about same-sex partners. Moving to sexual identity, we have about 1 or 2% who identify as homosexuals, twice as many who identify as bisexual, and a minority who also identify as pansexual. So those different dimensions don't overlap. They're not synonymous. And when you take those different dimensions together, you pull them together, you see that a significant proportion of the population, up to 22% for women and 14% for men, don't strictly identify or attracted or practice heterosexual matters. And this goes up to 37% of women, 18% of men who are less than 30 who are either attracted, have had sex, or identify with people of the same sex. Now, shifting from partners to actual practices, we also observe a diversification in non-vaginal penetrative sexual practices. You see here the rise in different types of sexual practices: masturbation, oral sex, and anal sex. And again, 3 bars corresponding to 1992, 2006, and 2023. And what's really striking, for instance, is the percentage of women who report masturbation that has increased from 42% to up to 72%. For men, you also see a rise, but not as steep, as this practice was much more common already in 1992. So as a result of this, the sexual repertoires of women and men are becoming more similar, with women increasingly exploring a diversity of sexual practices. And this trend is mostly prominent among young people who diversify their sexual practices earlier on in their sexual career. And that's in contrast with the older generations that generally included those types of sexual practices later in their sexual lives. Ultimately, today, young women are learning to satisfy their sexual needs similarly to the way that men have integrated these sexual practices earlier in their sexual career, effectively narrowing the gender gap. The diversification also implies where sexual exchanges take place with an extension of sexual practices online. This is a representation of the proportion of people who have ever exchanged an intimate image, either a photo or video with a partner, or have received a photo or video from their partners. This practice is much more common among younger generations, but 36% of women, 39% of men under the age of 30 have ever exchanged those images online. Most of these practices are consensual. However, sexual harassment online is a rising concern. And here, this is looking at people who receive unsolicited sexual images or victims of the diffusion of an image of themselves without their consent. And you see that about the same proportion of men and women of all ages suffer from these events. But this proportion is alarming among the younger people. It's 1 in 3 women and 1 in 4 men below the ages of 30. And this brings me to the topic and focus on sexual health. And I'll start with the issue of the reporting of lifetime sexual violence. And specifically looking at reports of forced sex or attempted forced sex. This has dramatically increased since 2006, particularly for women. And from 18 to 23%, while for men, it's about stable at 6%. Many of these events happen before the age of 18. This is represented in the graph on the right, with the darker part of the bar representing the proportion of these events that happen before the age of 18. However, the increase over time is largely a matter of reporting. And we can look at that by comparing the same age cohort that was interviewed in 2006, and then 17 years later when they're interviewed in 2023, and looking at the date of the first event. And that's where we see that many events that are reported in 2023 actually occurred before 2006, and they're not reported in the 2006 data. So this phenomenon reflects a shift in the understanding of what constitutes sexual violence. And for example, the legal recognition of marital sex didn't occur until 1992 in France. But additionally, movements such as Me Too have empowered individuals to come forth and share their experiences, such as reports in a national survey. Sexual health also encompasses the prevention of STIs and pregnancy. So here we're looking at protection at first sex, use of condoms and use of contraception at first sex, again, since the 1960s. You see a sharp rise in the use of condoms and contraception, both for women and men, especially concentrated in the 80s and 90s. And that corresponds to national campaigns to prevent HIV. This is still at a relatively high level since the early 2000s, but you kind of see a trend towards a decline, and especially a drop in condom use among females, that green line, in the most recent period. So in 2023, 75% of women, 84% of men report using a condom at first sex. And when you turn to more recent events and protection, looking at condom at first sex with a new partner in the last 12 months, you see a significant drops, with about just half of the sample and young people using a condom at first sex with a partner and a new partner in the last 12 months. So in fact, despite delayed age at entry and first sex, we don't see an improvement in the prevention of STIs, with leaving young people at greater risk for STIs. STI prevention also comes with vaccination, and we looked at HPV vaccination on the left and hepatitis B vaccination on the right. Again, we're looking at women and men by age groups. And basically the message is coverage is insufficient. It's rising by generation, but about only 61% of girls who are less than 30 or less than, no, I think 30% of girls who are 15 to 19 have been vaccinated against HPV. You also see kind of a gender divide. Generally, men are less vaccinated than women. And in the lighter colors in the bar, this is the proportion of people who don't know their vaccination status. So sexual health literacy is also a concern, and especially a concern for men. Does it matter in terms of prevalence? So here I'm turning to the biomarkers, where we estimated chlamydia, mycoplasma, and gonorrhea. I'm not showing gonorrhea. We just had one positive screen. But generally, prevalence is low, 0.9% for women, 0.6% for men. For chlamydia, and 3.1% for mycoplasma versus 1.3% for men. Obviously, it's higher for younger people. But what was really interesting is the highest prevalence for chlamydia was for people who are 26 to 29. And those are the ones who just missed the threshold of systematic screening that goes up to 25. And so they're excluded from that systematic screening. We also see higher prevalence among those who have same-sex partners, and specifically for men, and people who have multiple partners in the last year. Last but not least, I'm going to turn to contraceptive use, with, again, the theme is change, a huge change in the landscape. High contraceptive coverage in France, about 9 in 10 women who need contraception are using any method, and that's in the light blue in the graph. You see stability between 2016 and 2023. We have more time points for contraception than for other indicators. But that 9% has doubled since 2005, which is a big deal in terms of prevention of unintended pregnancy. At the same time, the choice of methods has really changed. And if you're looking at the middle of the graph, that kind of middle tone pink, that is the fall of the pill that used to be the most popular method in France, with more than 56% of women in need of contraception under the pill in 2005, and that has dropped to 26% in 2023. So what happened? Well, we had a pill crisis in France in 2012 around issues of risk related to third and fourth generation pills. And while kind of declines in pill use precedes this pill crisis of 2012, you see a sharp decline in pills to the benefit of IUDs that are in that darker column at the bottom, that for the first time become the most popular method in France, with 27% of users in 2023 versus 26.8% of users of the pill. It made it just very close. And in that lighter pink color, you also see a rise in condom use and barrier method use. This pattern is most concentrated among young people, less than 30, and just between 2016 and 2023, we found a 17-point drop in pill use, which remains the most popular method in that age range, to the benefit, again, of IUDs that increased by 8 points and condoms by 4 points. Does it matter? Well, yes, it matters. When we've turned to unintended pregnancy, we actually find an increase in the reports of unintended pregnancy in the last 5 years. Again, we are comparing 2016 to 2023. Overall, there are about 13% of people who report an unintended pregnancy in 2023, which is 4 points more than in 2016. But the wording of the question was different, so I'm not even presenting those results because it's very sensitive to the way we ask the questions. But here I'm looking in this graph at the last pregnancy in the last 5 years and reports of pregnancy intentions using exactly the same terminology in 2016 and 2023. And what, again, we confirm is an increase in the reports of pregnancies that are unintended, meaning they're wanted later, they're not wanted at all, or people didn't even think about the question when at the time of conception. And this trend is particularly marked among young people. Those are the first two bars. The first one is 2016. The second one is 2023. You see in that dark purple, that's the decline in intended pregnancy to the benefit of that light purple. Those are pregnancies that were wanted later. And this is the last results. And then you have a quiz. But kind of a summary of all of what we've learned. There are 3 key messages. The first one is the emergence of what we refer to a paradox of sexuality in France, with on the one hand, a decline in sexual activity, but on the other hand, much more diversified practices. This trend is not new, but it has accelerated, and especially among young people in recent years, and is closing some kind of a gender gap because women are having much more diversified sexual experiences. And to some extent, it reflects increasing autonomy of women in other spheres of life, and which also transposes to sexuality. Also with changing sexual norms with greater acceptance of a diversified sexual repertoire. The second message is the challenge of the heterosexual norms with greater social acceptance. I didn't show those results particularly, but also more increases in same-sex practices. And even among people who identify as heterosexual, more broader sexual repertoire that's not only penile vaginal sex. Finally, we note concerning sexual trends with prevalent issues of sexual violence, including online experiences, suboptimal STI prevention, and a changing landscape of contraceptive use, which may insufficiently protect young people against STIs and unintended pregnancies. I'll stop here, just kind of address a few limitations that I know are going to show up. There are 2 that are major. One is representation of the sample. And the other one is it an issue of reporting, or is it that people are really changing behaviors? There's not much we can do around representation except post-stratification weights. And in terms of reporting, the way that we address that is by training interviewers and also setting the questionnaire so that we gradually ask people to basically tell their stories with coherence between the questions that are asked, which makes it quite difficult to lie throughout the questionnaire. So with that, I'd just like to acknowledge all of my co-partners. This research is funded by the French government. I would also like to acknowledge 3 people and thank them. One is my husband, who has supported me and is in the room for over 5 years, and that hasn't been always easy. We've had working meetings in the car where I was discussing the formulation of very specific questions, as you may kind of relate, while he was trying to concentrate on trading and negotiating contract deals with global partners throughout the world. So that was quite a distraction. The other person I'd like to thank is Beth Frederick, who helped me get over my fear and anxiety of facing a room of 50 journalists and talking about these issues on TV. And the last people I'd like to acknowledge are my friends and colleagues, including Kristen and Celia, who've basically accompanied me throughout the journey and through the frustrations of the French IRB and many more. So thank you. I guess I can open it up for questions. Yes, Kelsey.
May have addressed this, but how did you handle people's trans, non-binary, and otherwise queer identity?
Great question. And I didn't present that. Number one, I didn't have much time. And second, we have much difficulty around this. We start the questionnaire by asking people to identify as male, female, or other, and that didn't work at all. There are only 30 people who identified otherwise, and we specify what is their identity, so that didn't work. But later in the questionnaire, we also ask a question about, have you ever thought about changing genders, with different response about yes, and I have started acts to do so. Yes, but I haven't had any, I didn't do anything about it, or no. And in that case, there are many more people who have at least thought about changing genders. We don't know if it's still current or not, but it's about 2% of the populations. And so we are, actually, I didn't say that, but there are 4 articles that are being reviewed right now that will be published in the journal Perspectives on Sexual and Reproductive Health. And one of them is around gender and sexual minorities. So you have much more information about those populations. Great question. Yeah.
So one of the things that your study includes is pornography, but you didn't present on that today. And one of the talking points among some circles in the US is the reason why people aren't having sex is because they're substituting with pornography or other types of digital interaction. So I was wondering if your French data show anything related to that, or? Yeah.
I haven't looked at it yet, so I can't tell, but that's definitely a topic of investigation, and how pornography relates to practices as well. Oh, sorry, I'm not. Look.
She says, great presentation.
Thank you. Great presentation. She's. So in the unintended pregnancy, yes, abortions are reflected, but typically in this kind of survey, about 1 in 2 abortions are reported. So it's not the best way to track abortion trends, but we do have national data on abortions, and they pretty much mirror what we're looking at, as kind of abortions went down until, I believe, 2012 actually, and have started to go up again, with a rise between 2016 and 2023 that is pretty much in line with what we're seeing on unintended pregnancies. Kristen, and then Kirsta. Oh, thank you.
So, I mean, you presented a lot of really interesting findings, but I want to know, you were in France for this big, huge press tour on TV, radio, everything. Which of these findings attracted the most attention among the French, and why do you think that is?
Several things. The decline in sexual activity was a great concern, and when we told them that sexual satisfaction remained stable, they were appeased. I think they were surprised around delays in first sexual intercourse. Um, the striking results around sexual violence as well. Those were kind of key points, and they were fascinated with the diversification of sexual experiences, especially for young women, and kind of the social interpretation of those results. So many things. We were very popular for a little while. Actually, the French national radio did a whole day around the release of those results with many, and we have podcasts. We became celebrities for 24 hours. Yes.
I was wondering, I mean, I think it'd be hard to forget that you have a Gardasil vaccine because there's 3 of them and it's quite painful. So other than reporting as a potential reason, are there any other thoughts on why those vaccine rates are so low? And then is it reflected in HPV related cancer rates in France? Is that a concern?
I don't know quite anything about HPV cancer rates. They do screening, so that works. I think the issue of vaccine hesitancy is huge. It's not only around HPV, and it's growing around all concerns around vaccine. In the case of hepatitis B, there was one of many crises, media crisis in France in 1998, actually, related the hepatitis B vaccine to multiple sclerosis. And that's a whole generation of young people, because vaccination is for newborns, basically. A whole generation of young people are not vaccinated because of that media coverage around unsubstantiated associations. Yes, Kirsta, I think you had a question. No, I mean, I think some trends are the same. Rise in age at first sex is definitely common with the US. Some commonalities about people being hesitant around hormonal contraception, that's a trend as well. I'm not sure around condom use, and I'm not sure around STIs. I think there are different dynamics in this country, and it's very also dependent on where you are in the US and what types of population we're talking about. Charlotte.
Thank you.
Somebody's monitoring time.
I'm curious if you've looked at the association between your measure of sexual satisfaction and any of the other sexual health measures and outcomes you looked at or behaviors.
So the only thing we did with sexual satisfaction is an article that I looking at sexuality as a predictor of health outcomes and general health, perceived health, and mental health in particular. It's correlation, it's not causation. Obviously, a lot of people look at it in the other direction. But what we do find is sexual satisfaction, more than sexual activity or type of sexual activity, is a strong correlate of perceived health and mental health. Even when you adjust for chronic conditions, when you adjust for a disability, and age and other confounding. So strongly linked, at least. I would like to say that more satisfaction brings more happiness and health, but can't say that.
There's 2 more chat questions. We asked any clues on why the decline of sexual activities across the board in recent years. COVID increased social isolation in general.
Yes, and again, I think, I would argue that there's a decline in partnered sexual intercourse, but When people report sexual activity in the last 12 months, they generally report on penetrative sex and they don't report on other forms of sexuality. So we don't have really a sense of if their sexual experience is declining or it's just partnered sexual activity that's declining. Oh, David.
How did you handle COVID, and did you see a shift even over the 12, 14 months? I think you started in November.
That's great. So actually COVID was in the way. That's why it took so long. As we launched this study just before COVID. Actually, I was on the field training the interviewers when our president at the time closed the borders, and my husband called me at 3 o'clock in the morning saying, you need to come back home. The borders are closing. So basically that's postponed the study for almost 2 years because a lot of our indicators are indicators of sexual activity in the last 12 months. And so obviously the social disruption linked to COVID, we couldn't include those social disruptions because that would mess up our trends analysis. So we waited until the end of 2022 to start the study, which is pretty much a year after any kind of social isolation types of events that would have restricted people's movements and social movements and partnerships. So that's kind of the best way we addressed it. All of the studies, there's a UK study coming out, an Australian study, all of the studies have been postponed because of COVID. I think I have to end it here. I don't know what time it is, but I think it is time, right? Oh, no, 3 more minutes if somebody has a last question. Okay.
Well, okay, wonderful overview, number of parallels with the US. Are you able to get a sense of the variation of sexual practices from one encounter event to another? I'm assuming that a respondent's reported type of sexual practice is not static over time and maybe fluid.
Yes, so are we able to kind of track changes in sexual practices over time? So we have 2 indicators. I showed lifetime sexual practices, but we also have for every one of those in the last 12 months. So and also at last sex. So we do have different ways of timing, how different practices are integrated in people's sexual careers to some extent. But we do not look at differences in sexual practices depending on partners, which would have required a different way of asking questions. And with that, maybe let's end here. Thank you very much.